We're talking with Barbara Abruzzo, who is a healthcare professional who started her own healthcare navigation, Living Well Partners. She's a counselor dealing with doctors and healthcare, and again, bouncing between being a provider and being someone who needs healing at certain times. Do you see any changes that have happened in medicine in your lifetime? For the better?
It's a really interesting question, Glenn. So, well, yes, of course. I think that, all the new technologies allow for certain things to unfold. It's a really interesting question because I feel a little biased in that since I've been in the system, and I will say not just as a patient, as a little girl, but from the time I was training to become a registered nurse and then practicing nursing at Columbia and North Shore Hospital here in New York, that I worked in critical care areas. And even then, there was such an acute nursing shortage. And now it's at like a ridiculous levels. I mean, people don't realize how compromised they are when they enter a hospital, even when it's a great hospital with a great physician, because there's such a nursing shortage, and that the majority of hospitals, the proper nurse to patient ratio should be 8-1 when you're on a medical or surgical unit. In an ICU, it should be 1-1. And or CCU, coronary care unit, intensive care unit. And do you have any idea? Well, I mean, you probably do, Glenn, but what the standard in most hospitals is, what the nurse patient ratio is on a medical surgical floor?
Christina, take a guess.
On a surgical floor? Oh my gosh. I would think.
Yeah.
Oh, I would think the numbers that you quoted were still low. So, I mean, if you're saying that there's been a big change, maybe 12-1?
So a typical, like a good hospital, a really good hospital, it's 20-1. And in a hospital that's very poorly staffed, it can go up to 40-1. And the New York Times wrote an article a few years ago. They did a very long-term study that for every patient a nurse has above the ratio that should be 8-1. So if the nurse has 9 patients, and I'm saying typically a nurse will have 20 patients in a good hospital. So they have 12 patients above what they should have to provide good care, quality care, to do everything that's necessary. Your chances of dying increase by 15% for every patient a nurse has above the ratio of 8-1. So when you went to a hospital, so you really want to stay as healthy as possible for as long as possible. Hospitals have their purpose. Glenn was a trauma specialist. You really need that emergency room. We need hospitals, but you don't want to be lottie dying into a hospital. It's really you really need to take great care, and you should have private duty nursing round the clock if you can afford it, so that you are not compromised, and you should know how to minimize risk of complications when you're hospitalized. But more importantly, try to stay healthy by healthy diet and lifestyle, so that, and by really managing your health issues so that you don't wind up in a hospital. And so there's that piece of it. And of course, there's also a critical shortage of primary care physicians. So, and as Glenn knows, there's now, we went, once HMOs came into the picture, we went from where you could see your general practitioner who was really skilled at handling many, many, many things, almost the majority of your health issues. And you would see a specialist if you needed surgery. Now there are so many specialties and subspecialties in medicine that you're many times, if you're seeing more than one physician other than a primary care physician and internist, your doctors aren't speaking to one another, and that can really get you into trouble. So care becomes very fragmented, and things can drop through those cracks, those fragments. And so healthcare consumers need to be very vigilant, or have a healthcare navigation specialist like myself help them organize and communicate with all their practitioners so that everybody's on the same page. And then we have the issues of what's going on with super infections in hospitals, and again, the heavy use of antibiotics for ridiculous reasons, like you have the flu or a cold, really has led to bacteria in hospitals, the superbugs developing, where whatever a hospital uses, they really can't keep the bacteria count down.
Mm.
And but there are these technological advances in medicine. Like, we know more about the brain than we've ever known. Charlie Rose had the great 8-part special on where he had all these neurologists from all over the country, and it was just amazing. They took you from conception to elder care and Alzheimer's and what actually happens with the brain. And they really know so much more now because of the imaging and the technology. And surgeries can be done so differently now using robots and things that we could never do before, so it's less invasive. So in that way, it's much better. But I feel that the other side is so skewed, Glenn, that patients are really compromised.
Mm.
I love that. Barbara, is there anything that we have not discussed that you really wanted to bring up before we come to a conclusion today?
I don't think so. I think that I feel that it's very important that people realize, first, that they stay as healthy as possible for as long as possible by taking great care of this vehicle that carries around their spirit. It's really important. Your body really needs really healthy living foods and clean air and love and joy and less stress. But when you're in a crisis, it's really important to reach out to someone like myself, or people who label themselves as patient advocates, healthcare advocates. I define what I do as healthcare navigation specialist, or someone like Glenn Wollman, so that you have the support and guidance. And I would always recommend that that person be a medical doctor or a registered nurse, that you have the support and guidance of someone who really understands the system and knows what a good doctor looks like, knows what good care looks like, and can help you make good choices for yourself so that you or your family member can get the best and the right care.
Well said.
Very well. Mm.
I'm grateful to my very special guest, Barbara Abruzzo, for sharing her wisdom and experience, an amazing experience with all of the things that she has done and continues to do for all of us in terms of the healthcare experience.
Thank you. Thank you, Barbara. You are such an inspiration to so many, I'm sure, for this Lyme disease and everything else in life. Really, you've gone through such a great journey, and we really appreciate you honoring us with sharing so much of it. Until we meet again, namaste.